So good afternoon, everyone. So good afternoon, everyone.
Good
Good
afternoon,
afternoon,
sir.
sir.
Today we are going to discuss initiation and progression of mobilization. So last class, I think we completed this slide. The topic is initiation and progression of mobilization. So today, whole of the class we are going to discuss only this slide, only one page we are going to discuss. So what is the meaning? Initiation and progression of treatment. That is, if a patient is coming for a treatment, so already we discussed, first we will evaluate in the first slide. Here we already discussed in the beginning. You have to examine and you have to evaluate and you have to check the quality of pain. This is quality of pain. You have to check the capsular restriction is present or not. And then you will select the grades and dosages of movement, that is mobilization. So now in this slide, what you can see is, what you are seeing is initiation and progression. Initiation and progression. That is, if the patient is coming, how you will start the treatment, how you will initiate the treatment, and gradually how you will progress the treatment. That is the topic which we are going to discuss. So here, if you see initial treatment, first you will go for sustained. That is, when the patient is coming to you, clear for us on the first day, that is before treatment starts, what you have to do. Suppose if a patient is coming to you with limitation of range of motion, shoulder, for example, shoulder joint range of motion is limited here. So he is coming with limited range of motion. I will discuss with example. A patient is coming with pain and limitation of range of motion. A patient is coming on to you. What you will do first? How you will start? Which grade you will select? Which technique you will use? You will use graded oscillatory technique or sustained translatory joint play technique. Which technique you will select and which grade will you select? So this is the question. Okay, I have told there are two techniques are there and total 4 plus 3 grades are there. Here in graded oscillatory technique 4 grades and sustained joint play technique 3 grades. So which technique you will select and what grade you will apply? That is the question. How you will select or how you will choose the grades or how you will start the treatment. Clear. First is initial treatment is you have to give Sustain grade 2 joint traction in resting position. See, it's difficult topic. Try to concentrate, listen carefully. Initial treatment, that is, a patient is coming for the first day. What you will do? You will go for grade 2 joint traction in resting position. So what is this? This point we already discussed. Where we discussed? Here we discussed initial treatment. And I have told you last class, I will explain you later. Initial treatment to determine how sensitive the joint is. You will use grade 2 of SGPT. That is initial treatment. Whenever a patient is coming to you, first you have to go for SGPT grade 2. What is grade 2? Here, this one. You will distract the joint till the restriction or till you feel the tissue resistance. Imagine this is the glenohumeral joint and this is joint capsule. This is here. And you are giving first day, you are giving grade 2 distraction. What is grade 2 distraction? I have told already. Distraction is always perpendicular to the treatment plane. What is treatment plane? Treatment plane is you will take a point axis in convex surface, center point of the concave partner. You will draw one line connecting these two lines, and you will draw one perpendicular line to the line drawn center to the axis, and this line is called as treatment plane. And what is distraction? Distraction is given perpendicular to the treatment plane, and gliding is given parallel to the treatment plane. All these we discussed earlier. Now what we are going to do? You are going to do the distraction, grade 2 distraction, that is initial treatment. Here, you have to start any mobilization with grade 2 of SGPT, sustained translatory joint play technique. Are you clear with this first point? Yes or no?
Yes, sir.
What is the purpose? Why you are giving this grade 2 joint distraction? Why? In order to find, or no, in order for this to find the sensitivity of the joint. Yeah, this point is slide we have. In order to determine how sensitive the joint is. So in order to find the or to check the sensitivity of the joint, you will give grade 2 distraction. Here, and second. Now what is next step? Now, day 2. This is first day. Clear? And this is now second day. What you are going to do? What you are given grade 2 distraction in order to find the sensitivity of the joint. That is how well the joint is responded. How well the joint is responded to the treatment. So you have already given grade 2 distraction. This I am calling it as treatment. Clear? So now, first day you had given grade 2 traction, that is distraction, and then you are checking how well the joint is responded. You are checking the sensitivity of the joint. Okay, first day is over. Now second day, that is day 2. Now this is day 2. And you are checking the response of the patient. Clear? You are checking response because what is the purpose of giving grade 2? To find the sensitivity of the joint. So second day you are calling the patient, or maybe next session, usually second day. If the patient, what is the possibility? There are three possibilities are there. One is the pain may be same. Listen carefully. After giving grade 2 distraction, there are three possibilities are there on the second day. Either the pain may be same, or the pain may be better, or pain may be reduced, or what is the third option? The pain may be increased. There are three options are there after giving grade 2 distraction. Are you clear? Yes?
Yes, sir.
So after giving grade 2 distraction, on the second day, either the pain may be increased or the pain may be same or better. So the further treatment after initial treatment, now it is progress. You are progressing to next level. It depends on further treatment depends on the response of the patient. That is day 2 treatment. It depends on the response of the patient. So we discussed there are three possibilities are there. What is the response? Pain is increased. First we will discuss if pain is increased, then how you will progress. Pain is increased, then what you will do? You will go for grade 1 oscillation in resting position. So now what is this grade 1 oscillation? पेन इंक्रीज हो गया पहले मतलब डे 1 इनिशियल जो डे from the day initial from the first day the pain is increased. After giving grade 2 distraction pain is increased, that is increased than first day. पहला दिन से और ज्यादा पेन हो गया. When compared to the previous day, pain is increased now. Now what you will do? How you will proceed? How you will proceed? That is, you will give grade 1 oscillation technique. What is grade 1 oscillation? Grade 1 oscillation is, I am talking this one. Grade 1 oscillation technique. What is the beginning first treatment? This is the first treatment. Initially you are given grade 2 SJPT, sustained joint play technique. This is the treatment you are given first. Now what happened? Pain is increased. Now, what is the second day treatment? Second day treatment is you will give for you will go for grade 1 oscillation. Listen carefully. This is practical topic. First we had given grade 1 distraction, grade 2 distraction. Pain is increased. Then you had given grade 1 oscillation. This is day 2, second day. This is first day. So what will happen if you are giving grade 1 oscillation? Second day, you are giving grade 1 oscillation technique in resting position. This we will discuss sometime later. In resting position, you are giving grade 1 oscillation. So now, what is the use of grade 1 oscillation? What will happen if you are giving grade 1 oscillation? What will happen if you give grade 1 oscillation? Grade 1 oscillation will reduce pain. You already know. Grade 1 oscillation will reduce pain. There are two reasons we have discussed. How the pain is reduced? By inhibiting the mechanoreceptor and by improving the nutrition to the injured cartilage. Last class we discussed. So when you give grade 1 oscillation, pain will reduce. वही चाहिए हमको, क्योंकि पेन अभी ज्यादा हो गया. पेन इज इंक्रीज्ड, है ना? पेन इज इंक्रीज्ड, so you have to reduce the pain. How you will reduce? By giving grade 1 oscillation. Are you clear till now? Yes? Am I audible? Hello?
Yes, sir.
Yes, sir. Yes, sir.
Am I audible? Oh,
Sir.
okay. So now, this is second day treatment. And now, third day, this is progression. Next, how you will progress? After giving grade 1 oscillation, now you will go for grade 2 oscillation. Clear? What is grade 2 oscillation? Here, this one, grade 2 oscillation. After giving grade 2 oscillations, then the patient will be, the pain will reduce, pain will be either same or the pain will be better. That is, the patient came with less pain. The patient came with less pain. Patient came, yes, he came with pain. He came with less pain. But what you have done? You have given grade 2 fraction. Because his sensitivity is high. What happened? Pain is increased. He came with pain, but now pain is increased because joint is sensitive. Clear? So now what you have done? You had given treatment and reduced the pain, and you had brought to his original or the day 1 situation. Or maybe the better, it may be better. After doing this much treatment, after giving grade 1 oscillation and grade 2 oscillation, maybe the pain the patient may feel better. After giving these two treatment, maybe the patient he feel better, or he may feel he may have the pain as same as he came to you. So if the patient pain is same, then you will follow this treatment. If the pain is better, then you will follow this treatment. I think I am clear. So we will take another example. So in brief, अभी मैंने क्या किया, I will tell in brief. First, what I have done, I will again tell you what I had done. Again, okay. So first the patient came, I had given grade 2 SJPT, grade 2 sustained, because this is the grade which will find the sensitivity of the joint. So first I had given grade 1. What happened? Pain is increased. So what I have done, I went to oscillatory technique and I had given this treatment, grade 1 oscillation. Then I go for grade 3 oscillation. Clear? So after doing this, after following this procedure, then what I will do? I will now the pain is same. Now what I will do? I will go for sustain grade 2 traction. Sustain. What is sustain? Sustain means SJPT. Clear? This is graded oscillatory technique. Graded oscillatory technique, and here sustain SJPT. You are repeating same here. Sustain grade 2, sustain grade 2. Both are same. Clear? So you are, if the patient is having pain is increased and pain is decreased, but this decrease is same as first day, then what you will do, again you will repeat the treatment. This one you will repeat again. Why you are repeating? Because in order to maintain the joint play, in order to maintain the joint play, you are repeating the treatment which you had given on the first day, because you know grade 2 is used for to find the sensitivity, and this is SJPT. Grade 2 is used to find the sensitivity of the joint and to maintain the joint play. First you had given to find the sensitivity. Pain has increased. So what you have done? Grade 1 oscillation and grade 2 oscillation. Pain is reduced. Again you are giving grade 2 SJPT. Why? To maintain the joint play, so that the range of motion will not further deteriorate, or the range of motion further will not be reduced. So you are repeating. Now, next what you are doing, and okay. So this is now. I'll explain later now. Now you go for next. The patient, if the patient is having better, that is from here to here. A day one patient came with pain. Day one patient came with pain. What you are given grade two traction, distraction. What happened? The pain is better, reduced, which means the joint is responding. The joint is responding to your treatment. That is why the pain is better. Previously, what? The joint is not responding to your treatment. Not responding to your treatment. That is why the pain is increased. Yeah, this is patient A. Now patient B. Patient came with pain and you are given joint 2 distraction. Now pain is better. Clear? So now what you will do? Now you no need to repeat this treatment. You will go for next grade, sustain grade 3 technique. Clear? You can skip all these flow chart. Clear? Now again, okay. It's confusing. Okay. So now patient came with pain. You had given grade 2 distraction. Now the pain is better. When pain is better, directly you will go for grade 3 sustained traction. Now what is grade 3 sustained traction? Are you listening? Yes? Yes or no?
Yes, sir.
Yes, sir.
Now we are talking patient B. First you had given grade 2 and the pain is better. Directly you go with grade 3 distraction, that is SJPT. From here directly you go to grade 3 distraction. Previously what we done? Previously what we have done? After grade 3 2 distraction, pain is increased. Then we have selected grade 1 and grade 2 of oscillation, and then pain has reduced, and then we came here and again we are given grade 2. Clear? That is what that was patient A. But now patient B is, first you had given initial treatment grade 2, pain is reduced, and directly you have given grade 3 distraction. Clear? First you had given grade 2 and directly you went to grade 3 because pain is better. If pain is increased, then you went like this and you came back. Because second day the patient response is good, directly you went for from here to here. If pain is increased, then you will go like this. Okay. So now this is second day treatment. Sorry. This is second day. And what is the treatment on the second day? Clear? Sustain grade 3 technique is given Why you are giving grade 3? Now question. Why you are giving grade 3? Because grade 3 will increase the joint play. Grade 3 will increase the joint play. How the joint play is increased? What is joint play? What is joint play? Joint play is gliding, spinning and rolling. Yes, they are joint play. When you give grade 3 mobilization, joint play will increase. How and why? Because in grade 3, what is happening in grade 3? You are crossing the tissue resistance. Or in other words, you are stretching the capsule. If capsule is stretched, then there will be more space for joint play. If capsule is stretched, why the capsule is stretched? Because you are crossing the resistance. If capsule is stretched, there will be more space available for joint play. If joint play is increased, range of motion is increased. Okay. So first you are giving grade 3 technique to increase joint play. So there is a simple rule. Yes. There is a simple rule. I will tell the rule. That is grade 1. Okay, I'll draw the one, two, three, and 4. Yes. This is graded oscillator technique. And next is sustain translative joint play technique. What is this? Grade 1, grade 2, and sorry. What is the mistake? Anyone can tell? What is the mistake I had made here? Yes? Anyone? Anyone? Yes? Pardon?
Grade 2. It is still
Yes, grade 2 I had made mistake. Okay. So I'll tell one simple rule. Suppose, listen carefully, grade 1, 2, 3 and 4. If if I am selecting, I'll take suppose if I want to give grade 2 mobilization of GOT. Suppose if I want to give grade 2 mobilization, first I have to give grade 2 SGPT. This is the rule. Corresponding SGPT should be given first. Again, I'll repeat. Suppose if you want to give grade 2 GOT, first you have to give grade 2 SJPT. पहला ये करना चाहिए, है ना? G2 GOT करने के पहले G2 SGPT करना है. This is rule. Clear? So this is what we have studied just now. Acha. So this, where it is coming in this diagram, you can see here. This diagram, what is Grade 2 GOT. Where is grade 2 GOT? This is grade 2 GOT. Where is grade 2 SGPT? SJPT. Here is grade 2 SJPT. So what you have done? ग्रेड 2 ऑसिलेशन करने के पहले आपने क्या किया? ग्रेड 2 ट्रैक्शन दिया है. बिफोर गिविंग grade 2 oscillation, you had given grade 2 distraction. This is the rule. Okay, next. Why this to be followed, I will tell later. Second, if you want to give grade 3 GOT, where is grade 3 GOT? This is grade 3 GOT. First, you have to give grade 3 SJPT. Grade 3 SJPT. Clear? ग्रेड 3 GOT देने के पहले ग्रेड 3 SJPT देना जरूरी है. Why? Now you see in this diagram, where is it? Where is grade 3 GOT? Graded oscillatory technique here. It will be here. Grade 3. Here. Gliding. You are giving grade 3. Grade 3 GOT. So what you have done first? You have done first grade 3 SJPT. Sustain means SJPT. Sustain grade 3 पहले दिया आपने, बाद में oscillation दिया. Grade 3 oscillation दिया. Are you clear what I am saying? Yes? Hello? Yes? I am not hearing. Yes? Can you hear me?
Yes, sir.
So now, next question. When you are giving grade, now I am asking you a question, anyone can answer. If I want to give grade 1 oscillation. Oscillation means it is graded oscillatory technique. What I have to do? First I have to give. Yes. Come on. Answer the question. If I want to give graded oscillatory technique grade 1, दिशा बताओ. Hello.
Grade 1
Yes, sir.
distraction.
Grade 1
Distraction.
distraction. Okay. So this grade 1, yes, your answer is right. Before giving grade 1 oscillation, you have to give grade 1 distraction. But you have already given grade 2 distraction because this is the initial treatment. Right. Already we discussed When the patient is coming on the first day, you will give grade 2 distraction. So it is not necessary for you to give grade 1 distraction. Here, it is not necessary for you to give grade 1 distraction because you have already given grade 2 distraction. So you can directly, that is why you see here, we have given grade 1 oscillation after giving grade 2 distraction. Are you clear what I am saying? See,
Yes, sir.
the rule is corresponding oscillation should be given oscillation should be given only after corresponding what distraction is given. This is the rule. Oscillation should be given, clear, only after corresponding distraction is given. That is, अगर grade 1 oscillation देना है तो पहले grade 1 distraction देना है. First you have to give grade 1 distraction. Grade 2 oscillation अगर देना है तो grade 2 distraction should be done first. Grade 3 oscillation देना है तो grade 3 distraction should be given first. This should be given first. Clear? But here, that is why this is grade 3. This is grade 3 oscillation. Before giving grade 3 oscillation, first you had given grade 3 distraction. Clear? So grade 2 distraction के बाद, after grade 2 distraction, what glide you can give maximum? You can select either grade 1 or grade 2. Because already you had given grade 1 distraction, no need to give grade 1 distraction for oscillation. Are you clear? Any doubt? Yes? Okay. So now you will give, after giving grade 3 distraction, you will glide grade 3 oscillation. You will go for grade 3 oscillation. If grade 3 oscillation is painful in restricted direction, you study this sentence. So what is this? Here you are giving grade 3 oscillation technique, GOT. If gliding, that is grade 3 gliding in restricted direction is painful. What is restricted direction? Suppose if the patient is coming with abduction limitation, abduction range of motion limitation. Clear? What is restricted gliding for this patient? Inferior gliding is the restricted gliding. Clear? Because if the gliding is normal, abduction will be normal. If gliding is restricted, then abduction will be limited. Clear? So now, what is the meaning for restricted direction? In this case, inferior. Clear? If the patient is having if gliding in restricted direction is painful, that is, when you are giving inferior glide, if pain is present, that is the meaning for this sentence. If gliding in restricted direction is painful, then what you will do? You will glide in the painless direction. What is painless direction? Either anterior glide or posterior glide. Yes, of course it will not increase the abduction range. It is not going to increase the abduction range. Still what you are doing? You are gliding in the painless direction. Clear? So now, if gliding is, again you read this sentence, you will understand. If gliding, that is, if gliding in inferior direction, that is restricted direction is painful, then glide in the painless direction. Or if restricted without pain, that is inferior glide is not painful. Suppose if inferior glide is not painful, then what you will do? Then you will glide in the restricted direction itself. Clear? First glide, this is grade 3. I am talking grade 3 glide. Clear? Because here we are doing grade 3 में आ गए हम. Because grade 3 distraction के बाद grade 3 glide आना चाहिए. So if grade 3 glide is painful in inferior direction, then glide in other direction. Suppose if patient is having no pain when giving grade 3 inferior glide, then you proceed in the same direction. Give the glide in the same direction. If restricted without pain, glide in restricted direction itself at the end of the available range. Clear? Now it is grade 4. Available range में glide means it is grade 4. Clear? So now, last point. Grade 4. So before giving grade 4, what I have told, you should give corresponding distraction. Clear? But there is no grade 4 distraction. There is no such grade 4 distraction. So directly after grade 3 distraction, you went for grade 4 mobilization. Any doubt? Any doubt? Clear?
No,
All are
sir.
clear? All are clear? So again I will repeat this topic because it's a practical lecture. Explain theoretically. With example I will teach you. But this flow to start, how you will start the treatment, how and how you will process. Yeah. So we will discuss tomorrow.